Cholera. Long since eradicated in the developed world, still kills 500,000 children a year. That is why scientists at icddr track cholera and other diarrheal diseases year-round. Established in the 1960s as the Cholera Research Laboratory, the scientists at icddr soon developed an international reputation in global health research.
We are an international organization hosted by the government of Bangladesh and devoted to the public health problems facing people living in poverty in developing countries. For over 50 years, we've served as a center of innovation. We're probably best known for having developed oral rehydration solution for the treatment of pediatric diarrhea.
While developing countries are not the first place people look to find a public health revolution, icddr's world-class facility in Dhaka has served for decades as a global hub for cutting-edge research on enteric diseases. The institution began in an attempt to discover and develop realistic, scalable interventions for cholera and other diarrheal diseases, and has since grown into the world's largest diarrheal hospital, treating more than 200,000 patients a year, almost all of whom recover within 36 hours. And yet, diarrheal research and treatment presents only a fraction of what this research institution has accomplished and continues to achieve on a daily basis.
It's estimated that about 50 million deaths have been avoided by the use of oral rehydration solution, which was pioneered by icddr. And The Lancet, the prestigious medical journal, said that this was probably the most important medical advance of the 20th century.
icddr focuses on 5 public health goals: reducing maternal and neonatal mortality, preventing and treating maternal and childhood malnutrition, controlling enteric and respiratory infections, detecting and controlling emerging and re-emerging infections, and achieving universal health coverage.
And we have a very exciting pipeline of products and interventions for public health in developing countries. These innovations include products and interventions to alleviate morbidity and mortality from severe pneumonia, severe acute malnutrition of childhood, maternal hemorrhage during pregnancy and childbirth, tuberculosis, and cholera.
icddr's world-renowned MATLAB field site, also called Mecca of Public Health, is the longest-running health surveillance site in the world and serves as the origin of many of icddr's health innovations. Public health and policy experts worldwide recognize and acknowledge the immense contribution the research and demographic surveillance at MATLAB has made to advances in global health. icddr is developing a roadmap to establish the practical steps by which universal health coverage can be achieved, and establishing a learning platform to support the sharing of knowledge on universal health coverage. icddr reinforces its efforts through publishing its research, training, and continuing to build a cadre of public health experts and capacities for low and middle-income countries.
The Hilton Humanitarian Prize will allow us to further develop and evaluate these innovations, and if justified by the scientific evidence, to roll them out in developing countries.
We hope that this prize this year will not only recognize the tremendous achievements of icddr in fighting cholera and reducing child death due to diarrhea, but that it will also be an inspiration to other institutions in the South to pursue a similar path. Because in this century, the 21st century, we need solutions from all corners of the globe.